Okay, I'm here with Steve. This is one of Dr. Wellens' patients. And Steve, if you could just I'll kind of ask you some questions to give a brief testimony about what you've experienced here at Central Florida Foot and Ankle. So, what is actually the reason you came to see us here?
I had a badly torn Achilles tendon. So bad that the doctor in my hometown, Sebring, Florida, felt that there wasn't anybody there that could fix the problem and recommended I come up here and see Dr. Wellens, which of course I did.
Okay. So Sebring, obviously, as people know, that's how long did it take you to get here?
Well,
Roughly.
about an hour.
About an hour?
Or less.
Okay.
It's not a bad trip at all.
And that's Dr. Luption. She actually refers a lot of patients over here for a second opinion because since Dr. Wellens is a specialist. So you came here to see Dr. Wellens and you probably came with your MRI and all that stuff, right? Okay.
I did.
And so then Dr. Wellens took a look at it and what did she say?
She immediately said I needed surgery. There was no equivocation at all on her part.
Okay. So were you in pain obviously at that time when you came?
Excruciating pain. And I had been for quite some time. I'm kind of a bull about pain. I spent 8 or 10 months trying to heal this thing myself. Lay off of it, go back, whatever. It got so bad that one day I couldn't get out of a golf cart, and it took 4 of my friends to get me home and in my house. That's how excruciating the pain was.
So you knew it was time to seek a professional then, right? Okay.
Absolutely.
All right, so she took a look at the MRI and knew you needed surgery, so then did you go on with the surgery?
I did. My surgery was, I believe, the 4th of February
Of this year?
of this year.
Okay.
It was very interesting. Dr. Wellens that morning looked at me and she said, now when you wake up, you're going to have a cast on your foot. And she said, the rule is for the next 8 weeks, nothing but air touches the bottom of that cast. And she was very, very explicit about that. And I can say to anybody, first of all, I would listen to everything she says and everything the staff tells you to do, because I'm a walking example of how well you can heal. I had no pain at all.
So what was your pain level before the surgery?
14 was off the map.
On a scale of 1 to 10, it was 14.
Off.
So it was, okay. So obviously you said you couldn't even walk. You couldn't even golf, which of course you'd want to do if you could.
I'm kind of a bull about pain. I walk right through it. I tell people it's nothing but pain. If it's not leaking, it should work.
Right.
Trust me, this wasn't leaking. It didn't work, and it was excruciating.
So here we are, the last day of August, and this is what, your final appointment?
Final.
Okay, and you're walking fine now? Or?
Fine. I'm back to playing golf twice a week. I'm probably going to go to 3 times a week in another week or 2. Walking uphill to tee boxes and uphill to greens, which I thought would be a tough thing to do. I have absolutely no pain, no problem at all. I'm tickled to death.
So you have zero pain at all? Right. So obviously we have a lot of patients that have Achilles tendon issues. Hopefully none that have excruciating pain, but if they sense any kind of pain, you probably would recommend going to see a podiatrist, definitely.
Without a doubt, and don't wait till anything like the length of time I did. After studying the situation, I understand now why I couldn't heal it. So if you have that kind of Achilles tendon pain, don't think you're going to heal it on your own, because you're not. And Dr. Wellens is absolutely equipped to do whatever you need to make it right. I'm convinced of that.
Well, good. We're glad you're all pain-free and you're back to golfing again, and we appreciate the testimony. Thank you.
So am I. Thank you.
You're welcome.